Hello, everyone. Thank you for joining us today on the program Healthy Living. I'm Adisu Walsawage, and today we want to look at proactiveness in dealing with some diseases. It's no longer news that cholera is in Nigeria. Luckily for us, we don't have a single record of it in Edo, and so we're grateful to God for that. That does not mean that if we lose guard, like they say on the street, if we lose guard, we cannot experience it, but we're hoping and praying that we will not experience it. So we want to look at proactiveness in disease control in Nigeria, or particularly Edo State, having cholera in mind. And joining me to discuss this is no other than Dr. Esegbe Efelmo, as the Director of Disease Control and Immunization, Edo State Primary Healthcare Development Agency. A pleasure to have you join us today,
Thank
Doctor.
you very much for having me.
Yes, so a lot of persons are surprised that, like Edo is very close to Lagos State, yet we are hale and hearty, we're happy with ourselves. We don't have any single record of cholera.
Yes.
So,
Yes.
how did we manage to achieve such a feat?
All right. Like you said, well, first of all, we'd like to thank God for this. Well, currently, this year we had the cholera outbreak in about 34 out of 36
Out
states.
of 36 states.
Yes, and Edo State is one of the states that has not had a single case up until now. So we're grateful to God, and we're grateful to the government of Edo State for putting systems on ground to ensure that our healthcare is protected in this state.
Okay, that's nice. I know that the Federal Ministry of Health, even the state healthcare providers they have adopted a practice strategy that prioritizes prevention of non-communicable diseases through promoting healthier lifestyles and regulating harmful substances. But unfortunately, a lot of diseases that we think ought to have phased out are still being experienced. What could be responsible for all of this?
Okay, well, are you making reference to cholera now or
Well, we're looking at
non-communicable?
cholera and other diseases.
Okay, well, for cholera, we have what we call the State Integrated Public Health Emergency Operations Center.
Okay.
And this is made up of a lot of multi-stakeholders, not just in the health sector, but in the environment sector, in the education sector. Various sectors come together to ensure that we have preparedness plans. We don't wait for outbreaks to happen. We have preparedness plans that we act on to prevent.
So there are strategies already.
Oh, certainly, certainly. So, and this prepare, especially for cholera now, we're actually working on some plans that has to do with advocacy, social mobilization and communication to ensure that we let our people know about this, what they need to do to avoid this. We engage various community heads and community members to ensure that they avoid the risk factors that can lead to them coming down with cases of cholera. And then we also have members of the Environment Ministry on the team that go around to enforce certain standards to prevent overcrowding, improper sewage disposal, lack and the use of insanitary materials, and then that could lead to contamination of food and water.
You know that when we're talking about diseases like cholera, we look at should I call it now, the villages, the local community, and all of that. It's not something that easily occurs in urban centers. It's not as if it does not happen. It does. So you just talked about engaging the community, but how do you engage the community? How is the engagement like to prevent these diseases?
Okay, so thank you very much. So when we engage the community, we like to let them know what the risk factors of this disease is and how they can overcome it. For instance, cholera is a disease of that can be gotten from contaminated food and water. The organism, if the organism is passed into food and water from improper sewage disposal, people can come down with cholera. So we let them know what the sources are and that's what actions they can take to ensure that they prevent contracting this, or if they show symptoms, if they have this, where they can go and get help and not self-medicate. Because for some of the cases of cholera that are symptomatic, death can occur in a couple of hours. So we let them know about this and where to seek help so that they can quickly be treated, because it's very treatable. They can be treated and they can be well and go back home to their families.
So where are these places that they can go to
Okay,
seek
so
help?
some of most of the wards in the state have primary health centers where they can go, and then they can be evaluated by our healthcare workers who work there, and where necessary, they can be referred to secondary and tertiary health facilities. So currently in the state, like I was telling you about the preparedness plan that we have in place, we have test kits.
Okay.
Yes, especially in high flow facilities.
Okay.
Yes, so that when any patient who is having diarrhea presents in any of those facilities, we make sure that it's not cholera. And if it's cholera, it's treated promptly or referred to a treatment center.
Are there doctors in those facilities? Because often a time when we have calling programs, you hear people saying that there are no doctors in these facilities,
Okay.
only nurses. Sometimes
Okay.
the places are locked and all of that.
Okay. Okay. Well, I would really want to give credit to the current government of Edo State, and we hope that subsequent governments will continue in the strides that this government has taken, because
Okay.
going through medical school and residency training, and we've always heard about primary health centers being the first point of call for everyone in the community.
Sure.
So that's why I said we have at least one in every ward in the state. We have about almost 500 primary health centers. Some of them were built from political maybe interest, not necessarily in every community. So those that had political interest maybe had like one or two in their communities and so on and so forth. So, but this government has tried to revamp, not just revamp the facilities, provide equipment and recruit massively. I've seen a lot of, in fact, in all the LG local government areas now, you can boast of several doctors manning several primary healthcare facilities. It has never been so, and it is not so in many other states of the federation. So we need to give kudos. So, and we need to keep building on that, especially in this era of the Jackpot syndrome, to be able to keep doctors in the local government areas. So certainly, you may not be able to have doctors in all these facilities, but in most of them, you have doctors, and that those that don't have doctors can refer to, and then from there they can be referred to secondary or tertiary health facilities.
Okay, we know that technology is the hub of development in any society.
Yeah.
And we also want to look at technology in all of these hospitals. How effective are this technology? Is it that is government investing in this area?
Oh, certainly, certainly. Especially, I can speak for the Edo State government and what is done in primary health sector. So just now, the government has set up a telemedicine platform where even those facilities that we said didn't have doctors can consult with doctors remotely.
Oh, fantastic.
Yes, even with doctors outside the country. So through that telemedicine, the nurses and the community health essential workers and the community health officers in those facilities can help consult with doctors and get appropriate care without moving
You
those
know all
patients.
of this work with the internet. What about areas where there are no internet facilities?
Yes. Now there are fiber optics being spread across the 18 LGAs.
Okay.
But in most of the zones, the territorial zones, like for instance in Edo Central, in some parts of Edo Central, Ukbenu PAC specifically, they've had those telemedicine services running, and we have a lot of them in Benin City that has those fiber optic cables for the internet services. So the plan of the government is to ensure that these fiber optic cables go across the 18 LGs, and all the facilities have free internet services like there is in Benin City currently.
Okay, during the COVID-19 episode, we had a lot of successful stories in Edo. In fact, Edo was one of the best. We had very little case of COVID-19 patients and all of that. Edo was kind of proactive. There was proactive initiatives, so to speak. But with other diseases, Is it that because it has not happened yet, that's why we don't know if there are some proactive initiatives already on ground?
Okay, when you mean other diseases, do you mean
Like
communicable or non-communicable?
communicable diseases, non-communicable diseases,
Okay,
you know.
well, we have a
Mostly
surveillance.
communicable diseases because that
We
is what we suffer more.
Yes, we have a surveillance system, a disease surveillance system,
System.
where we report all priority diseases, communicable diseases and non-communicable diseases from every local government area, from every facility. And this is coordinated by the disease surveillance and notification officer at the local government area, and further coordinated at the state by the state disease surveillance notification officers and the surveillance team.
Yes.
So we have trends, we have records of those disease surveillance. So that is what prompts the emergency operations center to swing into action, to take steps to mitigate any communicable disease that is getting beyond the threshold that is the norm for that area.
Okay.
So then when we talk about non-communicable disease, we at the Edo State Primary Healthcare Development Agency, we've developed plans to ensure that we have affordable screening programs for all those who should be screened for non-communicable diseases,
Okay.
so that they can be encouraged to come and screen for those non-communicable diseases almost at no cost, so that we can detect certain things early, and then we can prevent avoidable deaths.
Okay. You did say a while ago that there's a high rise in preventable diseases that could have easily been prevented using immunization.
Oh yes.
Why so?
Well, we think that maybe because some of our people have not been seeing vaccine preventable diseases over time, they've become negligent. But I'm very comfortable. So we want to use this opportunity to appeal to our parents, caregivers, especially the mothers and the fathers, to ensure that their children get routine vaccines in our healthcare facilities, which are completely free of charge. They will protect not just the children, they will protect their families, and they will protect the society at large. Because it's something we call herd immunity.
Okay.
When all of us are immunized, then it's difficult for a disease to penetrate a community. But when you have a large population of unimmunized people, then it's easy for such diseases to penetrate that community and start spreading amongst those who may be having some immune issues at that point in time.
What do you think would be responsible for this nonchalant attitude of persons or parents or mothers not wanting to immunize their children?
Well, one of the reasons we feel, especially in the urban areas, is that we feel that a lot of mothers are working now, a lot of fathers are also working, so sometimes they don't have the time to come to the health facility to immunize their children when they should. So as a state, we're trying to increase the schedule for immunization to even include weekends, so that we can increase the chance of them coming to take those vaccines. Even though those vaccines sometimes are multi-dose, in that you can have 20 doses in one vial in some of them. So sometimes, to avoid waste, we try to pull children together so that we can use that up instead of opening just for one person and discarding, because they're costly. So, but we're also trying to encourage that they come, and then we're also trying to let them know the importance of these vaccines. You understand? It will obviously reduce childhood mortality and morbidity in the first 5 years. A child that is vaccinated and is well fed will most likely survive the first 5 years of life. The reason why vaccines are given at specific periods, someone asked me a few days ago, and I told him, you see, the breast of the mother contains some antibodies that will help the baby up to a point. So it gets to a point where
that's for lucky babies who have their mothers
to breastfeed, up to a point. So at that point where those antibodies are no longer available in the breast milk for that child.
So it gets to a point where those antibodies disappear.
Yes, as in may not be able to protect
at what point exactly?
At different stages. So it's at that stage you see us introduce the vaccine to provide external protection, as it were, not from the breast. So that's what happens. So those vaccines come in and then protect those children to ensure that they don't contract those diseases and fall ill. We've began seeing some vaccine preventable diseases in Edo State now.
Okay.
Yes, we got reports from
what kind of disease now?
diphtheria, pertussis, measles outbreaks here and there.
Okay.
So we're intensifying
And
our
it's not
vaccination.
supposed to be like
It's
that.
not supposed to be like that if everywhere. So we're tracking migrants. We have a lot of migrants coming into Edo State who have zero dose children. What we call zero dose, they've not as in
Been
had
immunized at all.
pentavalent 1 vaccine. And we're trying to track them and we're trying to intensify vaccinations in various communities. We're not just waiting for them to come to the facilities now. We're going to various communities, riverine communities, hard to reach communities, and then we're also trying to train members of communities in those areas, those hard to reach communities and those security compromised communities, to ensure that they, when we send vaccines to them, they can administer those vaccines to those children to ensure that those children grow up healthy and strong.
I'm particularly worried about the storage of those vaccines, because I know that some vaccines have to be stored at zero,
Yes,
not
at 2 to 8 degrees.
2 to
in the
8
community,
degrees. So in such communities, we know that
Oh
power
yes,
is a problem.
yes. We don't give them so much like that. We put in a geostar box that can store those vaccines in 24 to 72 hours.
24
Yes, with
72
ice
hours.
packs. Yes.
So when they don't have enough children, those vaccines go to waste.
Oh no, we use their utilization to estimate what they will require per time.
Okay. Okay, now let's talk about cholera before we leave. What are the things we should look out for?
Okay, so my advice is that we need to improve our sanitation, because cholera comes from contamination of our food and water, from sewage and improper waste disposal. So we should ensure that we dispose our waste properly, and we should have a bin that has a lid over it. And then sewage disposal, we should ensure that we use the proper latrines rather than what they call bush attack. We shouldn't have indiscriminate
Bush attack.
we shouldn't have indiscriminate disposal of sewage. And then we should wash our hands and ensure that our personal hygiene is good. Wash our hands as often as possible. If you don't have water and soap at that point, you can use the hand sanitizer. And then we should ensure that our food is properly cooked before we eat. We should also ensure that for fruits, we should wash our fruits thoroughly before we take them. And where you can peel them yourself, you should peel them
So
yourself
we should
and
not buy pre-washed fruits.
no, not cut foods. So you should wash them yourselves, cut them yourselves, and then take that. And then if there's anybody who has symptoms of vomiting, passage of loose stools, they should present at the nearest health facility immediately. Because like I said, cholera is one disease that can kill within 6 hours, within 1 to 6 hours can kill. So it's better they present early to the facilities where the treatment is possible, and then fluids will be replaced, and other treatments, other medications will be given.
You know, unfortunately, some of us will not present early. You're seeing all of those signs and symptoms. We're running to the bush to get bitter leaves, scent leaves, whatnot leaves. Oh, all this will help. You know, regardless of education, some of us still do that. You just run to the back. Oh, I have this at my backyard. Is it not just stooling? Let me quickly run. Or you run to the nearest pharmacy or chemist, as the case may be, to get some tablets. Can you just tell us a word about all of this?
Well, we find out that most of the poor health-seeking behavior we have around here is mostly due to poverty. For most people that are health insured, they don't go around everywhere before they come to the health facility. They come to the health facility, and then they can make a diagnosis, and then they can treat immediately.
Okay, talking about disposing sewage properly, let's look at situating the borehole and then the septic tank almost at the same location.
Oh yes. The environmental people, the Ministry of Environment, they'll tell you that, and the wash people, that you should have at least 100 meters between the borehole for the household water use and then the sewage septic tank. So that we don't have the sewage contaminating the water
But unfortunately,
supply.
you see that in most houses.
Yes.
Most houses. I've lived in a house where such a situation happened. So what did we do? That was when we started. That was when we learned how to boil water. But it's still happening. Some persons are still in that house, and we're beginning to wonder what is happening in our state. Is it because we're managing space? and killing ourselves in the
You
process.
know, if we had municipal water treatment centers and supply, I don't think everybody would probably have a borehole in their houses. So, I think the Ministry of Environment are in charge of this, and we know that they are supervising the standards in these houses, and they can serve abatement notices and take defaulters to the legal procedures to ensure that they follow standards. So we believe that is being done in the state.
Okay, we're hoping and praying that someday healthcare services will be very available and accessible and very cheap for everybody, because as it stands, I will not lie to you, accessing healthcare services is quite expensive. Perhaps that is why people don't want to go to the hospital. Instead of rushing somebody to the hospital, I beg, let me use bitter leaf in my backyard. Let me use one agbo or the other. It is only when it becomes an emergency case, it won't go, it won't go. That's when people rush to the hospital.
So, but my advice would be that they should contact the Edo Health Insurance Commission. There's an Edo Health Insurance scheme, and there are very cheap packages of about
No, don't
18,000.
advertise for them. If they want advertisement, they will come to ITV and get that done. So we're not going to advertise for them. All right, doctor. I want to say thank you so much for finding time to be with us on the program
Thank
today.
you very much.
Hopefully we'll do this again to educate Edo people, to make Edo free of any disease at all. We want to be healthy, you know. The world is tough enough. The nation is tough enough. We're trying to surmount a lot of problems, which I know we will definitely surmount someday, somehow, because God loves this nation.
Yes.
All right. So thank you so much for finding time to be with us. We'll
Thank
see
you
you
very
again
much.
soon. All right, people. This is it. Your health is in your hands. Okay. Do the needful. Do not, let me use the street language now. Not take your head play panya. All right. We'll see you again. Bye-bye.